actually have some questions that a few of our faithful friends have asked. So Liz says, I was always told that I didn't have to worry about breast cancer until I was 40 and had to start getting mammograms. Can younger women get breast cancer? If so, when do you recommend starting self-breast exams at home?
So most women say at least by 20. And so if I am on the cancer.org, breastcancer.org, so that we are empowering women to do their own self-breast exam. We realize that in some women, this can be anxiety-ridden. Absolutely. If that is the case, then get with your provider, and we provide clinical breast exams from primary care to gynecology to breast health specialists. But if a woman gets to start knowing their breast and realizing their breast is going to change throughout their entire life, 20 is a really good time, because there are women that can have young breast cancers, and oftentimes it is related to a family history. But the sooner they get to understand the texture, their breasts, and how it acts on a monthly cycle basis, I think the better. These women can find things smaller and faster than we would, especially if we're not going to be starting mammograms until 40, or younger in women that have higher risk. I think it's important to realize that.
Amy would like to know, what are some signs and symptoms you would tell patients to look out for that could indicate you should be seen by a doctor?
Okay, so obviously a lot of the things that we get are nipple discharge, and want to let women know that if they're not breastfeeding anymore, spontaneous, or what nipple discharge that happens on its own, especially if it's dark, absolutely needs to be seen by a physician, and can be evaluated by primary care, gynecology, and then we work through all of those steps. The other thing we tell women when they're doing that self-breast exam, really important part of that self-breast exam is for them to look at the skin of their breasts in a couple of different positions. So one of those is by standing in the mirror with their hands raised above their head to look at the skin and the contour, and the other was with their hands on their hips, because that moves the muscles underneath the breast. And what we're looking at is if a woman has suddenly had a new inversion or flattening of the nipple, that needs to be investigated. Now there can be things that happen breastfeeding, as we're going through menopause, there can be some changes, but more so puberty, there can be some changes in the shape of the nipple. But if it's brand new in a woman that's over 30 and not breastfeeding, then that needs to be looked into. Also, if you suddenly see skin changes like pink coloration, thickening of the skin, and we call it peau d'orange, or the peel of an orange. If you look at an orange, especially a big navel orange, those little pinprick holes it has in it, that kind of texture needs to be investigated as well. Not to mention the breast lumps, obviously. That's the first thing that women want to call about. Talk with women if they're premenopausal, still having menstrual cycles. Most women can wait through that menstrual cycle into the next one, because cysts and fibrocystic nodules and nodularity will tend to kind of spike right before your menstrual cycle and then go down or get smaller afterwards. And if that doesn't happen, then you need to present to your physician.
Stacy would like to know, are mammograms covered by all insurance?
I cannot answer that question with certainty, but I've had very few instances where they were not covering yearly screening mammography starting at least at 40. 3D, actually in Tennessee, we're very lucky because of the law in Tennessee that we need to let women know that they have dense breast tissue. There has also been better coverage here now over the years for 3D tomosynthesis coverage by insurance. And women can actually even ask for that add-on themselves to their screening if they would like to have it done, because they've gotten a letter in the past that says they have dense breast tissue. It's not absolutely every insurance, but I actually did first start with most Medicare's covering it, and then most commercials have been on board with that now in Tennessee.